I'm showing it in sitting. You're going to essentially hook your thumbs underneath the occiput, and then you're going to walk your hands up until you find a bony prominence kind of in the center of the head. So there's external occipital protuberance. If you walk lateral to that, you'll be on the superior nuchal line, which again is an important landmark for the attachment of our suboccipital muscles. So right in here. Then we can palpate C2, which you guys have already done. You can walk down the midline of the cervical spine, and I'm gonna have her flex her head. Go ahead and bend down, good. Okay, and then come on back up. So by using flexion extension, I can feel that bony prominence pop out into my hand a little bit more easily. You can also use extension. Go ahead and extend back, and then you should feel it kind of disappear from your hand, and then go ahead and come back forwards, okay? From there, if you walk lateral, you can kind of get a sense for the muscular tissue that overlays that lamina groove, which includes the semispinalis capitis, as well as those descending fibers of the trapezius. So I'm essentially just kind of grasping that soft tissue. You're really not going to feel the bone here. It's really more about feeling the soft tissue. And then if you go a little bit more lateral and kind of pinch the fingers in, you're going to feel a little bit more of a bony prominence that's deep to the soft tissue. That would be your facet joints, okay? And so I'm going to use again movement to confirm. So we're gonna side bend and rotate a little bit. So as you do that motion of side bend and rotation, you should feel the facet joint so right now under my right finger is kind of moving slightly posterior to facilitate that slight rotation and side bending, right? Because our facet joints are going to move in this direction. So for you guys in G15, right rotation, the facet joint is going to kind of slide and glide posterior. Okay, so you can use that movement to confirm. And then from there, if you walk even more laterally and press essentially deep in, you're going to feel more of the transverse process, which oftentimes can be tender for patients. So are you okay here? Any tenderness?
A little bit, but it's doable.
Okay. So here's transverse process. Now we're on C2 transverse process. If we wanted to find C1, we'd go up to the mastoid, drop down and a little bit forwards, and then press in. Yeah, a little tender. Yeah. And then again, maybe let's rotate to the right. So you can play with rotation of the spine to feel how those transverse processes rotate underneath your fingers. Okay. Okay. So I think that those were main ones. Yeah. I don't think I missed it.